Hello and welcome to The Insider. I'm Lisa Adams. Welcome to our viewers and to our listeners on the radio. Today, our focus is on the work of the American Red Cross and specifically the Northwestern Pennsylvania chapter, how they serve our area and beyond, and what you can do to help them in their mission. My guests today are Mary Rogers, who is Executive Director of the Northwestern Pennsylvania chapter of the American Red Cross, and Kim Michael, Account Manager for the Red Cross. Welcome to both of you.
Hi, Lisa.
Good morning, Lisa.
Well, first of all, Mary, tell us when you took over the leadership here and a little bit about your own background that prepared you for this position.
I've been with the Northwest PA chapter since April of last year, but I have been with the organization for over 15 years. I started as a volunteer responding to disaster calls, and I've been an executive director in various chapters for the last 13 years.
That's a long time. So give us your take on what the main mission of the Red Cross is, and then maybe each of us can tell you a little bit about why you want to do this type of work.
Well, the main mission of the Red Cross initially started with Clara Barton when she was on the battlefield during the Civil War, and we were actually founded in 1881 as the American Red Cross. The chapter started in 1917 when it was chartered, and we have a variety of services. We've worked with the military for over 135 years, but most people probably know us because of disaster services and our response to home fires and other emergencies in our community, and of course, biomed or blood services.
Yeah, we'll be getting into the biomed piece of it a little bit later on. But Kim, tell us a little bit about your background, how you got involved working for the Red Cross.
Well, Lisa, I've been with the American Red Cross for 5 years. Prior to this, I was an event planner here in Erie, and I decided it was time for a change. And the Red Cross appealed to me because I wanted to do something important in the community, and the mission to alleviate suffering is a great mission, and I'm able to work with volunteer sponsors and blood donors throughout Northwestern PA, and we all work together to save lives collecting blood.
So tell us, Mary, about the footprint of the chapter here in Northwestern Pennsylvania. I know there's been some shifts in how things are organized across Pennsylvania in recent years. So how big is the footprint of the Northwestern Pennsylvania chapter?
Our chapter covers Erie, Crawford, Venango, Mercer, Clarion, Forest, and Warren counties.
That is a big area. So do you have staff and offices in each of those counties or just here in Erie?
Our main home office is in Erie on Pittsburgh Ave, but we do have offices in Sharon, Pennsylvania, Oil City, and Warren.
And so how do those counties work with you? How do you support them with resources, and how do you navigate being such a large organization?
Well, Lisa, I have to say the Red Cross is really about the volunteers. We really could not do what we do without volunteers. 90% of what we do is done by the volunteers that are helping us.
And then is the Erie chapter under the Pittsburgh chapter in some ways in Western Pennsylvania here, or are you independent of them?
No, we are all part of the American Red Cross, and our regional headquarters is in Pittsburgh, and our region covers 61 counties in Pennsylvania, basically most of the state except for the Philadelphia area.
Well, you mentioned disaster relief, and I think that's what most of us think of when we hear of the Red Cross helping in times of disaster. We certainly see it here when families are displaced by fires and groups of volunteers maybe head out to national disasters. But I know the Red Cross does so much more, and we'll talk about all the other things that they do when we come back. Stay with us. Well, welcome back to The Insider. Today we are talking about the work of the American Red Cross in Northwestern Pennsylvania. My guests again, Mary Rogers, Executive Director, and Account Manager Kim Michael. So let's talk about a typical day for the Red Cross here in our region. As we said, some of what you do is visible to all of us, but I'm sure there's so much more. So take us through what a normal day is like for you.
Well, for us, it's, we may have disaster clients to follow up with. We have emergency communications sometimes that we need to put through messages for the military. We may be working with volunteers. We may be doing preparedness education. So there's a variety of things that we do.
And Kim, maybe you'd like to add to that, what you see a typical day like, because it sounds like there's a wide variety of services that you're providing.
Well, Lisa, for me, I am constantly in contact with my sponsor volunteers who are arranging sites, reaching out to prospective donors, filling appointment slots, trying to collect as many blood products as they're able to. People are so willing to help, and it is just so refreshing to be able to have these volunteers reaching out and helping the blood supply. So again, I can't thank the volunteers enough. We're always looking for new volunteers to step up and host a blood drive, volunteer at a blood drive, or come up and donate blood.
Well, we'll get into the blood portion of things, the biomedical portion of things, a little bit more coming up. But Mary, you mentioned the relationship between the Red Cross and the military. So tell us how that plays out, what types of things the Red Cross does in its ongoing relationship with the U.S. military.
We have been serving the military side by side since the Spanish-American War. It really is how the Red Cross started with Clara. And we do a lot of things. The most importantly, we do emergency communication messages. So the military looks to the Red Cross to verify information if there's an emergency here at home and their military member is deployed in the country or out of the country. We have folks that will work with doctors, nurses, funeral homes to determine what the information is that we need to collect. And we pass that information on to the military through our system so that they know what for sure is going on here at home. And then the military will decide if that military member can have leave for the emergency. And oftentimes we're assisting that military member with transportation costs, things like that. We also work with the veterans long term. We're very involved in the VA hospitals. Doing comfort items, providing comfort items for those folks, and also working with the veteran if they're having issues, maybe paying a bill or something, we can help them with the military aid societies to assist them. So there's a lot going on. We actually have volunteers that work in the VA hospital throughout the year. It's not just a one-time-a-year situation for us.
I think the thing that we see most here in the news business is fires, though, and we certainly know that in the winter months there are a lot of fires around here. And so when a family is displaced by fire, tell us a little bit what you do, or really if they're displaced by any disaster.
What we do is the first thing we want to do is make sure that they have a safe place to stay. And if they need food, clothing, those kind of items, we will provide them with the financial resources to take care of that. But it's more than that. It's working with them throughout their recovery and helping them access other means of support that we may not be able to provide. We also have many professionals involved. We have nurses that will help them, get their prescriptions refilled if their home's been burned, or maybe they have special medical equipment that they need. And we have mental health professionals that help us, if somebody's having some difficulty getting through that situation.
So you're really connecting them to a lot of the things that they may need during a difficult time. I think the other thing that we see is when you deploy to other types of disasters here, or deploy teams around the country to help when there's a tornado or a hurricane. And we have a little bit of video of the work of the Red Cross. So you've both talked about volunteers. How much of what you do is handled by paid staff versus volunteers?
Well, Lisa, as far as the biomedical side of the Red Cross, of course we have our collection staff that show up on the front lines, and kudos to all those frontline workers who have been providing, letting us provide the life-saving products that patients in need on a daily basis. So our collection staff is paid for, their employees, but we solely count on mobilizing a volunteer workforce that is phenomenal, whether you're in biomedical, disaster relief, responding to fires. These heroes step up when they're needed, and thank you so much to them.
So, Mary, how's all your work funded? What role do local donations play in helping the Red Cross?
The American Red Cross is totally funded by donations from the public and corporate sector. So, we need those funds to be able to continue to do our work in the community. So it's vital to us.
Well, when we come back, Kim has mentioned the biomedical side of what the Red Cross does. We'll dig a little bit deeper into that and talk about a special blood donor app. Stay with us. Welcome back to The Insider. I'm Lisa Adams. Today we are talking about the work of the American Red Cross here in northwestern Pennsylvania. My guest again, Mary Rogers, Executive Director of the organization, and Account Manager Kim Michael. So as Kim has talked about, there is a biomedical team that's part of the American Red Cross. I will admit to not knowing much about this part of what the Red Cross does. Has that always been part of your mission, going back to Clara Barton?
Yeah, actually, one of the very first blood drives was held in the early 1900s in actually Rochester, New York. So, and the blood drives were started by the American Red Cross. So we're very proud of that. Every 2 seconds, somebody is in need of a life-saving blood product, and it cannot be manufactured. We count on volunteer blood donors to come and find a blood drive and donate. We have had some obstacles with COVID. Schools are a very large source of the blood supply, along with businesses. And, they had to meet the mandate of the state. So a lot of the blood drives were shifted to community blood drives. And there's a number of community blood drives that are around. You could always go to redcrossblood.org and put in your zip code and find a blood drive. We're always looking for a new sponsor, so please don't hesitate to reach out to the Red Cross and request the information.
So explain now how this works. Again, we have some video of the biomedical side of what you do, but are you regularly providing hospitals with different blood products, or are you providing blood products during disaster relief, or all of the above?
So the American Red Cross is the single largest supplier of blood in the United States. And when you come and you donate blood, it goes back to the center, it's processed, it's tested, and it is sent out to where it is needed most. And we actually have a blood donor app. You can go to the American Red Cross Blood Donor app and download the app, and you can make an appointment on this app. But I love this feature where once your blood is processed, you get your information back about all of your health history, your blood pressure, your pulse, your statistics, and after a few days, you get a little notice, and it tells you who you saved. And because blood can be separated into 3 components, you can save up to 3 lives. Now, you won't know the name of the person, but I have a very good friend who is very proud that his last blood donation went to Andrews Air Force Base and saved a life there. So really interesting, and it's convenient. You can create your next appointment. You can cancel and recreate an appointment. It nudges you and tells you when it's time to donate again. It only takes an hour. And you can save time by using this donor app and filling out the questionnaire before you come to the blood drive, and that'll help you save about 15 minutes. So the actual blood donation part takes about 15 minutes. It's all the prior to make sure that our blood supply is safe. So it will take you about an hour.
So anybody can download this app? I mean, how do you go about doing that, and how long have you been using the app? What kind of feedback are you getting about it?
Well, the app has been around for a couple of years. It only gets better and better as time and technology progresses. With COVID, it has just exploded. People are downloading it, they're excited, they know that they're helping somebody. And it's really helping us increase our donor base because it's nudging people to come and donate. The average American, only 3% of the population donates blood. And of that 3%, they only donate 1.2 times a year. So we're hoping this blood donor app will nudge you to, just donating a few more times a year. And that really will help the blood supply.
So if you sign up with the app and express an interest in donating blood to save time, as you say, then where do you go to physically make that donation? And how does what the Red Cross is doing with blood collection work with, say, the community blood bank here in our community?
Well, the community blood bank does the same thing that we do. We provide life-saving products to hospitals and patients in need. As far as making an appointment, when you download the donor app, it doesn't matter where you are in the country or northwestern PA. If you put your zip code in, you will find a blood drive that is near you. It makes it really convenient. There are different times, different places. If you're traveling throughout the country, put the zip code in. You can make an appointment wherever you go with the American Red Cross. It's very convenient.
So do you find that some people regularly donate, and how often would that be if you were a regular Red Cross blood donor?
It's interesting. I talk to other account managers throughout the country, and like I said, most people donate. Of the 3% of the population that donate, most only donate 1.2 times a year. I'm very fortunate. In northwestern PA, in all of my communities, Corey, Guys Mills, Venango County, Elk County, these people are coming almost every 56 days. It's so refreshing and it's so helpful to the blood supply.
And as you said, they're getting some feedback on their own health, so that's an interesting dimension. So if people want to know more about this, how do you suggest that they begin?
So I would visit redcrossblood.org. You can find out any information you'd like there, but just go to the App Store and download the Red Cross Blood Donor app. You will be glad you did.
Well, when we come back, the Red Cross needs more volunteers. We're going to talk about how you can get involved. Stay with us. Welcome back again to The Insider. I'm Lisa Adams. Today it's been all about the American Red Cross Northwestern Pennsylvania chapter with Mary Rogers and Kim Michael. So we did talk about the need for volunteers. Mary, what type of person are you looking for to help the Red Cross?
Well, Lisa, I can tell you that we always are in need of disaster response volunteers, but there are a variety of different options for volunteers. We need everything from professionals, nurses, mental health providers, to people to work blood drives, people to do clerical work. So it really is a vast number of opportunities for volunteering, depending on what your skill set is or what your interest is. And we also can adapt. Some of the things we do are all virtual, and some things you can, be boots on the ground. So it really is anyone that wants to volunteer in any capacity. There are so many options out there with the Red Cross. It's amazing.
So can you say that there are certain skill sets you need the most right now?
We definitely are in need of RNs and licensed mental health providers in our area, and disaster response volunteers is big for us.
So those would be, as far as the counselors or RNs, those would be people who are licensed or do that professionally, but this would be something they do in their off times, if you will?
Yes. Yeah, because we don't need them for every disaster, but when we do need a specialty like that, we need those folks available.
So for people who aren't coming in with a professional specialty, they just want to help in any way they can, how do you train your volunteers and what kind of time commitment is involved?
Well, it depends on what the job is that you want to do. Of course, first of all, we have to do background checks because, we're dealing with the community in a variety of ways. So they would need to go to redcross.org and click on the volunteer link and fill out the paperwork. And from there, then we have someone that would be getting back to them to talk about what they're interested in doing, what the skill set is, and what the training would be for that particular position.
And Kim, you mentioned COVID-19, but I mean, for both of you, how have you handled volunteering during COVID-19? Has that made people withdraw a little bit from involvement for their own safety? And is that something you're trying to come back from?
Well, Lisa, I can answer to that. I'm feeling very fortunate that during COVID-19, there are so many young people in the area, especially like around Erie. I have a lot of Gannon students, Collegiate Academy students, Mercyhurst, from all different schools and high schools and colleges that were actually like wanting to volunteer, but because of COVID, there weren't opportunities. So these kids get online and they find out the information, they sign up, and I have 2 or 3 people at my blood drive wanting to help, register donors, take temperatures, sitting with them at canteen. It's really refreshing. And if I can add something else, if you're thinking about becoming a Red Cross volunteer, this is a volunteer commitment that isn't so extensive that you can't handle it. You have options. Also, you can take it with you wherever you go. If you're a Red Cross volunteer and you live, for example, I was at a blood drive in Edinburgh and they just had a new professor come in, and she was a Red Cross volunteer out in Colorado, and she's like, hey, I want to become involved in the Erie area, and I connected her with our volunteer services here in our Erie chapter. So if it's something that stays with you, it looks great on a resume, and it really feels good to help people.
Very good points there. So we're down to the last couple of seconds here. Mary, if somebody is interested and they want to know more, is that what they should do? Go to the website?
Go to the website, www.redcross.org, or call our office at 833-0942.
And then click on, if they're on the website, just by putting in the zip code, they'll be able to get more information about their local area?
There are tabs across the top, and one of them is volunteering, so it's very simple.
But again, you can call the local office and ask some questions, and background checks are essential.
Absolutely. Thank you.
Well, Mary Rogers and Kim Michael, thank you both so much for being here and telling us more about the work of the American Red Cross here in northwestern Pennsylvania. And as always, thank you for joining us on The Insider. If you have an idea that you'd like us to explore, just email me at ladams@erienewsnow.com and join us again next time for The Insider.